While the COVID-19 pandemic has impacted every American on some level, it has put a spotlight on the economic inequalities and stressed an already fragile social safety net, leaving underserved communities to struggle against the virus with a lack of access to basic needs. With the understanding that the impact of COVID-19 on low-income residents of Ypsilanti might go overlooked or unreported, Marquand Jackson, director of Eastern Michigan University's Family Empowerment Program, partnered with the Washtenaw County Racial Equity Office and the Center for Equitable Family and Community Well-Being at the University of Michigan School of Social Work to survey more than 600 residents on the impact of COVID-19.
The sample size seems to be similar to that of the population of Ypsilanti, so it really gives us a snapshot into the whole city.
The research team adapted questions from the Detroit metro area community study COVID-19 Rapid Response Survey.
We really use the DMACS assessment as a starting point for us kind of putting together an assessment that really got to the nuances that individuals in Washtenaw County, in particular, the 48197-4898 zip code might be experiencing.
To ensure the study team captured the views of low-income residents and people of color, 159 surveys were collected among residents of the Ypsilanti Housing Commission, the area's public housing authority. Black respondents were far more likely to be renters unable to work from home or afford a $400 unexpected expense. Both Black and Latinx respondents were more likely to have lost their jobs as a result of COVID-19 and to have missed rent or mortgage payments.
Our Black residents were far more likely to be exposed to COVID in the community. Their knowledge of friends and family members who died of COVID was kind of representative of that fact. And so I think it kind of just put into real terms the impact of COVID and how it was disproportional on our Black residents.
Latinx respondents were also more likely to go without food.
The number of respondents who said they were, in the event that a vaccine was available, they were not interested in being vaccinated because there's a distrust as it relates to public health. So really asking the public health space to really be thoughtful around how do you build rapport and relationship with individuals so that we are able to get folks on board with being vaccinated. We worked with the graphic designer and we turned the data into an infographic, and we pushed that out to all of the affordable housing units in the county to deliver those infographics to residents who had been respondents. And so one of the things it was able to see that A, you're not alone, and B, these are some of the nuances that we found.
The study was backed by a $25,000 grant from Poverty Solutions, a University of Michigan initiative that aims to prevent and alleviate poverty.
Marquand saw the call for proposals and said, wow, this would really help meet a need that we have in our community to find out more around COVID-19 in this part of Washtenaw County that doesn't always get the attention it needs. So that $25,000 provided the seed money to do work that we all wanted to do and thought was important.